Good evening, everybody. I am Dr. MEENAKSHI Sundaram from Chennai. I have been practicing internal medicine and diabetology for the past 30 years. I did my MD internal medicine from Madras Medical College, and I've got my own diabetic center in Royapeta, Chennai, with over 10,000 registered diabetic patients. So we do a lot of work in diabetology in Chennai.
How does Imeglimin fit into your regular practice with the current landscape of T2DM treatment options? Kindly share your experience.
See, we have been using Imeglimin for the past few months. It's quite an effective drug. It has got a novel mechanism of action. Unlike other drugs, it has got multiple mechanisms of action. In fact, it addresses the insulin deficiency. It increases the insulin secretion. It improves the insulin sensitivity. It reduces the hepatic glucose output. It increases the glucose uptake by muscles. And not only that, it has got a novel mechanism of action by which it addresses the mitochondrial dysfunction, which no other drug does. So because of this, it has got multiple benefits. It preserves the beta cell function. It improves the beta cell mass. So these are the advantages. That's why in addition to the existing therapies, those with uncontrolled diabetes, this is a valuable addition in our armamentarium today.
In what specific patient populations do you see the greatest benefits of using Imeglimin?
See, Imeglimin can be used for most of our type 2 diabetic patients, particularly those with multiple comorbidities, those with increased insulin resistance, those are prone for micro and macrovascular complications, and especially those who are intolerant to other drugs. For example, if they have got GI intolerance with metformin, so they can tolerate Imeglimin much better, because the GI upset with metformin is much higher, whereas the Imeglimin it is very, very less. It hardly causes any GI upsets. So these are the advantages. These are the patient profile where we can use Imeglimin.
How does Imeglimin compare to other hypoglycemic agents in terms of safety and efficacy? You can share any real world case if you have.
See, Imeglimin has got excellent safety, tolerability, and efficacy profile. It reduces the HbA1c by 0.5 to 1%, comparable to most of the other commonly available OHs. And as I said earlier, it has got multiple mechanisms of action. It improves the insulin secretion, reduces the insulin resistance, and then, as I said earlier, it has got one particular, one specific thing it can do. It addresses the mitochondrial dysfunction. So because of that, it preserves the beta cell function, it reduces the beta cell apoptosis, preserves the beta cell mass, and this is unlike most of the other commonly available drugs. And the second thing is, it can be combined with most of the commonly available drugs. And in fact, when you combine it with insulin and sulfonylureas, we have seen reduction in the dosage of insulin and SUs. It's very, very common. It is compatible with most of the commonly available drugs.
In recent time, Imeglimin sustained release formulation with Indian study has been launched in India. What is your opinion on that?
See, compared to metformin, the GI upset is very less with Imeglimin, as I said earlier. But when you use a sustained release preparation, the GI upset is very, very less. It's like 50% less than the metformin sustained release preparation with a comparable efficacy. So you get a very good efficacy with very less side effect profile when you use a sustained release preparation. The Indian studies have confirmed that when you use the Imeglimin sustained release preparation, the GI upset is 50% less than the metformin SR preparations.
How does the mitochondrial targeting mechanism of Imeglimin influence its clinical use?
See, mitochondrial dysfunction is a key pathophysiological abnormality in type 2 diabetes mellitus, and mitochondria are important for several cellular processes, including energy production. So mitochondria is the key organelle in the cell. So when mitochondrial dysfunction is there is increased reactive oxygen species production. It can drive the oxidative stress and cause micro and macrovascular complications in type 2 diabetes. So once Imeglimin addresses the mitochondrial dysfunction, you get a complete reversal of all these processes. The production of reactive oxygen species comes down, the oxidative stress comes down, and then beta cell apoptosis comes down, beta cell preservation is there, and it protects the beta cells that way. And not only that, overall metabolic health of the cells improves when you use Imeglimin because of the normalization of the cellular processes in the mitochondria.
What are the key safety and efficacy findings from clinical evidences on Imeglimin that clinicians should be aware of?
See, coming to safety profile, several studies have shown that Imeglimin has got excellent safety and tolerability profile. The GI upset is very, very less. The hypoglycemia is very, very less. In fact, it works in a glucose-sensitive manner. It improves the glucose-sensitive insulin secretion in the beta cells. So it doesn't cause significant hypoglycemia, and it is weight neutral. In fact, in several of our patients, we have observed weight loss. Probably we need long-term data to show the weight loss effect. But we have personally, this is anecdotal, we have observed several patients with weight loss, especially those who are obese or losing significant amount of weight with Imeglimin. Coming to efficacy profile, studies have shown that it reduces the HbA1c by 0.5 to 1%. It has got an excellent efficacy, safety and tolerability profile, as I said earlier. And in addition, it also has been, because of the mitochondrial function modulation, it has been shown to improve the diabetic cardiomyopathy. It has been shown to reduce the neuroinflammation. So it has got multiple other benefits in addition to reducing the blood sugar levels.
Do you believe that Imeglimin has the potential to change the future landscape of diabetes treatment?
See, Imeglimin being a novel molecule with multiple actions like insulin secretion, insulin resistance, and then metabolic modulation, reducing the beta cell apoptosis, improving the beta cell preservation. So because of all of this, plus reducing the oxidative stress, reducing the micro and macrovascular complications. So because of these multiple benefits, it has got a promising future. It can be positioned in a significant way. As more and more research unfolds about the benefits of Imeglimin, I am sure Imeglimin will be a cornerstone of the management of type 2 diabetes along with the existing therapy, especially in those with uncontrolled type 2 diabetes.
Thank you so much, sir, for giving your valuable time. That's all for today's questionnaire. Any other key points or take-home message you would like to share apart from this?
Yeah, see, Imeglimin is a novel drug. We have been using it on hundreds of patients. We have found it very, very beneficial. Especially weight loss has been one thing which I have been informing the company people also, though they don't claim that. But clinically, we have seen many people lose weight. So we'll have to observe about the long-term data, about how other clinicians are seeing the weight profile. Plus, it has got multiple other metabolic benefits. Those with multiple metabolic defects, this is a very good drug, and it protects and preserves the beta cells also, in addition to reducing the micro and macrovascular complications. So long term, we will wait and see how the more and more research unfolds and where we position the Imeglimin in the coming years. Thank you.